Could I just say I love the word follicular. You say it so well. It's a bit like someone saying cart door. Follicular. It's great.
It doesn't sound so good when it's followed by follicularly challenged. That's not so good.
Welcome to the Joy Tuck Club, the podcast that celebrates the beauty and diversity of transgender individuals and identities. I'm Rachel, my pronouns are she, her, and with me is my wife and co-host, the beautiful Phoebe.
Also she, her.
What are we doing today, Phoebes?
Well, we're fishing for answers from our favourite follicular facilitator, Dr. Dilan Fernando.
Yeah, my own hairline feminizer, a sponsor of our upcoming book, How to Transition, and a very fine fellow in every way.
Indeed he is. He's also got quite a story too, from neurosurgery to co-founding one of London's most celebrated hair transplant clinics.
And you can really hear it in his voice how much he absolutely loves doing what he does.
Yeah, he has a certain something else, doesn't he?
Sure. The passion of an artist.
Uh-huh.
I love the way he sized up my scalp during the consult, pen held in hand, looking for all the world like a painter finding perspective.
Right.
It was quite fun having him use my head as a canvas as well.
I think it was one of the most joyful consults I've ever attended. But, let's get on with it. Let's hear from him.
Sure. Roll the tape.
Dilan, we're so glad you could join us today. Thank you for coming.
It's been a pleasure. Thank you for having me. I'm excited to be part of this.
We're excited to have you here. Before we talk about the specifics of hair transplants, let's stop by some other roots first. Your own, actually. You trained as a neurosurgeon, a brain surgeon.
I did.
But then you shifted your focus to the outside of the cranium.
Absolutely. I always say that, whilst my younger days was interested in neurosurgery and I was developing along that path as a junior surgeon, as I kind of thought about my career and what I wanted to do with my life, I thought, actually, I don't need to go as deep. And I went down the follicular route instead. And I really enjoyed my training, learning about hair transplant surgery, and actually realized that this was an industry that I was passionate about. I actually really enjoyed the surgery. And being quite honest, it was something that allowed me to create my own clinic, which would be more conducive to a more balanced lifestyle, which is something that was a really big value add.
It certainly was. You're now the co-founder of what must be one of London's most renowned and award-winning hair transplant clinics, the treatment rooms.
Yeah, it's obviously, sometimes it gives me shivers to kind of really be, in amongst some of the leading clinics in the UK, which is lovely. But if I'm honest with you, our processes have been very slow and steady. We've not tried to run before we can walk. Our focus has always been from the start just doing really good quality surgery. It's always been doing one procedure per day, one patient per day. And that just allows me to focus on the quality of the surgery that we do. And slowly but surely over the course of nearly 10 years now, that's established itself in producing a really amazing practice.
Could I just say I love the word follicular.
Right?
You say it so well. It's a bit like someone saying cart door. Follicular. It's great.
It doesn't sound so good when it's followed by follicularly challenged. That's not so good.
No, it really isn't.
Which is probably the nice way of describing hair loss to some of my patients.
So we came to see you in London. We were lucky enough to come to see you in London.
Oh, it's lovely to have you in the clinic.
And during that time, you said something in reference to transgender people that really struck us both. You said, you've made your picture, now you get the chance to frame it. Being trans often involves multiple surgical procedures, all competing for a limited budget, and some might need to wait years between. So where does hair transplant fit into that timescale? Would you recommend hair transplant before or after FFS?
It's a really good question, and it's actually a really challenging question. I completely, as I said to you, do believe in the idea that our hair should frame our face, and the face is the picture. And there's a lot of changes that happen to the face. It's not just FFS, but when we start HRT, there's facial changes there. People may be going through the process of epilation or hair removal. So all of these things are part of the evolving face that occurs during that transition journey. And so sometimes it can be premature to do a really final hair transplant too early because it may not suit the end face. But that being said, from a more emotive point of view, the hair can be a really big gender dysphoria or incongruence kind of troubling element to someone's dysphoria. And for that particular reason, that emotive side can be a real reason why people may not even choose to progress in their transition. And so for those people, there may need to be some sort of hair transplant intervention at an early stage. Again, it doesn't need to be the end framing of the face, but something that will help them pass, something that will help them feel more comfortable in their more feminine shoes, if feminization is what they're looking for. And that's kind of a bit of a tricky juxtaposition that some people have.
Hair transplants have been taking place since the 1950s. Actually, when we were doing the research, I noticed that in Japan they were practicing like eyelashes and eyebrows and so on from the 30s. But what's the difference between how it started and how things are done now?
Yeah, that was obviously like really well researched. Japan, and then it was in America. They started developing kind of eyelet transplants. So you would almost take something the size of a 5p coin, maybe a tiny bit smaller. So that's the kind of plug of hair that they would take from the back, and they would cut that out and put it to the top, and then you'd end up with lots of these little 5p coins of hair as a transplant. And that is where the term plug surgery actually came from, and they were doing that in the 70s and 80s. It was
like a doll's head,
genuinely right? Like a doll's head. And actually, I've seen transplants come to me, have patients who have had those types of surgery, and obviously it doesn't look natural. It doesn't have the softness, the featheriness, the naturalness that you would expect from a hair transplant in today's day and age. And the real kind of change that happened was when, rather than looking at the hair scalp as a clump of hair, we actually looked at each root or each bundle of hairs, what we now call a follicular unit. Rachel, your favorite word, coming back in there. But we got the concept of the follicular unit. Now that means that our hairs just to grow in very tiny little bundles, 2 to 3 hair strands in one unit, sometimes 4, sometimes 5, sometimes singles. But those units, the ability to transplant those as those little bundles became the advent of the modern era. That's when we can start creating more natural looking hair transplants. Now, originally, the way we would do that is the follicular unit strip technique, the FUT strip technique. That's where you would take a big chunk of scalp at the back of the head, and then you could just chop those up into the follicular unit, so you get all the little bundles, and then transplant them at the bundles. Now, more recently, in the last 2 decades at the very least, we can actually extract them as the units themselves using the FUE technique, the follicular unit excision technique. And like I said, what that really has allowed us to do is, transplant hairs at a much more microscopic level. And with that microscopic element to it, it allows us to be far more creative, far more artistic. We can place the single hair units at the front, the 2 hair units behind that, the 3 hair units to really bring in the density. So you're starting to see much more lovely natural results because of these modern elements to the surgical process.
We've started getting into the surgery now. So exactly how is the extraction and the transplant? How does that take place? Pretend I don't know anything about it.
Absolutely. So, from the surgical day perspective, obviously prior to that, there's a lot of conversation that happens, the consultation virtually, the consultation in person. These are crucial elements because that's the strategy, that's the planning. That is where I try and extract from your brain what you want from this process. And I put my surgical expertise into, okay, how can I create this scenario for you in the best way possible with the techniques that I have available? So I would say the surgical day starts well before that in the consultation process. But as you will have experienced, you come and sit down with me on the morning of surgery, and we have a good strategy and a plan as to what we do. So we start executing that in the way that we would have a chat in the morning, go through our paperwork, and draw the hairline and mark out the area of surgery that we're looking to cover. All right. Then we got to go to the surgical room and up to the prep room, and we kind of do all of the elements of getting you ready. That involves particularly local anesthetic. So this, I would say, for most of my patients, is the trickiest part of the surgical process. It involves small little sharp injections to the back of the head as well as to the front of the head. Rachel, maybe you want to comment about your experience and then what you thought about those injections and how manageable you found them?
That was actually the part of the whole process that I was dreading the most. I don't really like injections. But my fears were completely unfounded. It was really, really pain-free, actually, just a few little pinpricks, and then you can't feel anything, so it was good.
No, I appreciate that, and that's what we try and achieve. We use a lot of little tactics, vibration techniques, and obviously with a little bit of sedation to take the edge off things as well.
The sedation, I love that.
The good stuff, yeah.
Yeah.
And all of those things just help take the edge off the injections. And for me, it's really important if the patient's comfortable, then we can get them into a place where we can really do our work without having to worry about pain for the patient. And it allows us to focus on the surgery itself. So once we have, the patient numbed up and anesthetized, we do carry on with the actual surgery itself. An important part, just as part of the preparation, is the shave. I'm sure we'll talk a little bit about shaves and access a little bit later, but particularly for my trans patients, doing as much of my surgery with minimal shaving to the scalp is incredibly important, and that we do in the surgical room and on the table itself. But once we've done that, we've got all of the access that we need. The scalp is nice and numb. We carry on to the surgical process, and that involves taking the hairs from the back of the head, from the stronger parts of the scalp where those hairs are really thick, really healthy. Also importantly, they're resistant to hair loss. Now, hair loss, especially for my trans patients that are already on HRT, is not that much of a concern, but it's always nice to know that we're using hairs that are resistant to hair loss regardless. And so for that particular reason, we still use what is the conventional donor site on the back and the sides. We extract them using a very small, tiny circular punch to get those follicular units that we talked about. Those punches are usually less than 1 millimeter in diameter. So I'm using really high optical magnification to be able to see those roots. And particularly, this is where, again, you get the differences between certain clinics. We're using really high quality extraction instruments. I use a device called the WOW, which is a device made by DeVroy Instruments. It is phenomenal. I mean, the quality of the punch, it goes through the skin in a very smooth motion. It causes a lot less damage to the skin, meaning that the surgical scarring is reduced and minimized. It specifically also has a really nice smooth action that allows us to capture the follicular unit in its entirety. So sometimes you can use these poor quality punches, which kind of go and cut out one hair, but it kind of damages all the other hairs around it. And that's not what we want. We want really high quality extractions. And that's what these punches allow for. So we can basically kind of imagine the hair, cut around it, and score a little circle around it. And that frees up the root below. And we just take a pair of forceps or very fine tweezers that allows us to then pluck those hairs. And that gives us that follicular unit. And we just do that however many thousands of times that we need to do across the course of the surgery over the course of a few hours. And then that gives us a big, dish of grafts and of follicular units, which we can then use for the implantation process. That's where the technicians come into their own. They take those grafts and they sort it. And that's really important because that's, again, part of that quality process. They're checking that the grafts are of a good quality. They sort them into single hair units, double hair units, triple hair units, all underneath the microscope. And I don't know if you remember, Rachel, any of this happening in the background, but they also make sure we have enough singles for that frontal hairline to make sure that frontal hairline is soft and fluffy and natural. And, they can do that with the processes that they're doing on the microscope. Do you remember that part?
I do. I remember seeing them on the TV screens around me.
Yeah, exactly.
Yeah. I remember I looked on the board later, and it was covered in statistics, of how many of this kind and that kind and so forth. It was excellent. So organized. You had so many people there.
A lot of people are really surprised by that, actually, when they see it, just how many team members are involved in the process. And I think, I do get scared when I hear about clinics that are out there and they don't even have a microscope in the room. A lot of these processes are just like, take the hair out, pop it in a dish and pop it back in. Whereas actually that level of sorting that really does need to go into the process, and the team involved in doing that is really critically important to being able to make sure that when you're implanting those grafts at the last part of the surgery, that actually you're really kind of making sure that the right grafts are going in the right place, so you're getting that natural looking aesthetic. And that, I suppose, takes us on to towards the last phase of surgery. So once you've got the hairs and they've been sorted, it's about putting them back in. So this is again something that I specifically do myself, is I make incisions and holes for the hairs to sit. Now, this is really, really the artistic element. This is where I have to kind of take my surgeon hat off and put my artist hat on, my GCSE art from back in the days, and really about that. It's about trying to almost create something that is quite technical, but also it can't be too technical, because otherwise it doesn't look natural. And we create the recipient side. So in restoring, for example, or feminizing a hairline, we do want to make sure that we're still following the natural directions of the hairs. And then as you kind of come down these elements to the side of the head, close towards the temples and to these temporal peaks, is that it starts to go very shallow and acute to the hair direction. And creating those natural angles is exactly what I do with my blade. So my blade allows me to control the depth, the angle, and the rotation that the hair would have as it exits from the scalp. So all of that is controlled by myself as the surgeon doing those incisions. And then as you know, Rachel, right at the very end, we then have the team all together, myself also on the scalp, implanting those hairs. Again, controlling the angulation, controlling the depth, and controlling the actual direction of the hairs, so that when these hairs grow, they do generally show a very natural flow and a natural trajectory that the hairs should do in those particular areas.
Well, I think we can rip up our questions.
I know, it's a very comprehensive answer. You've literally taken all of our questions in one go.
I'll get really technical. I'm so sorry. I, as you know, and as you experience, I'm very kind of passionate about it.
Yeah. Well, two things stood out that I just want to highlight. One is you're talking about the tools and the quality of the punch, for example. And, the point of all of this is that what you're doing will stick, will grow. The graft won't fall out. And I imagine if you're kind of hammering some rusty nail in there or the equivalent, yanking out some hairs and trying to slap them back in somewhere else, they're probably not going to stick at the end of the day.
No, absolutely. That's exactly right. It is shown that if you're having a bit more of a smash and grab approach, which is how I describe it, is that these grafts don't survive. So what you have to realize is that the graft is a little mini organ in its own right. It has so many different constituents to it. And the moment you take it out of the body, you're taking it away from its blood supply. You're taking it away from its oxygen, and it has a certain amount of time before it will die, it will perish. And what you're then doing is reimplanting dead tissue. So if you're using surgical techniques that slow down, or using kind of traumatic techniques, which are also damaging the root in the process, and then also having roots sit in a petri dish and doing nothing for hours and hours and hours, and these are things that actually some clinics don't think about, that actually by the time they do reimplanting, it's dead tissue. It's not going to grow. It can even potentially be, an infection risk, or even cause more serious risks. And so the survival rate of that graft is maybe even the least of your issues. There could be other more untoward concerns that can happen. But absolutely, if you're not careful about your technique, or if you're even trying to do too much, you're trying to take too much out, and those grafts are out of the body for too long, and it takes too much time to put them back in, your survival rate drops and drops and drops. And unfortunately, that's why we see a lot of these clinics that offer, 5,000-6,000 grafts in a single session of surgery. A lot of those grafts just don't take, they don't survive, and you'll see hair transplant failure. So it's really important to that when you're thinking about hair restoration surgery or hair feminization surgery, it's really important that you think about what is your clinic and your surgeon doing to preserve your graft each step along the way.
And then, well, let's chat about aesthetics then.
Yeah.
The end result. So something I loved seeing was when you were during the consult and you were doing the lines on Rachel's forehead.
Yeah.
And you were standing there and you were holding the pen like an artist holds a paintbrush. And
Thank you.
I have to ask: is your house filled with pointillism?
Unfortunately, it isn't. It's probably filled with like technical cricket drawings and things like that. But I
Fair enough.
but I do love my art. Yeah, absolutely.
Yeah. Well, so what are the most important results visually? And could you explain again why the angular incision is so important? And the difference between trans women and trans men, receding temples, widow's peaks. How do you take it all into account?
Yeah, it's all for me. It makes sense in my head, and I'm trying to, and it comes from years of experience. But trying to relay that out. So essentially, for me, it's incredibly important that we look at each person individually. Their facial anatomy is entirely individual. They've got different muscles, different bone structure, different hair colors, different hair types. So all of these elements have to come into play when designing a hairline. So when I have that eyeliner pencil in my hand, I'm thinking about all of those things. I'm also thinking about the conversations that we've had in the consultation, what you want to achieve from the process. So, for a person who has experienced hair loss, a man with a hair loss where they have a widow's peak or a natural M-shaped hairline, these are the hairlines that we would consider to be masculine. And so for someone who's looking to transition, that is undesirable. That's often a very obvious way that someone could be clocked, I believe is the term that sometimes gets used, that they are a transgender female rather than having a natural feminine hairline, which is what we would associate to be more rounded. So that's the two clear distinctions. You've got an M-shaped hairline, which is masculine, and a more oval, rounded shaped hairline, which is feminine. So a lot of my trans patients will have the issue where they've experienced recession, or they just have always had an M-shaped hairline. And as part of that consultation, we look at and explore the use of hair restoration procedures to be able to change the M shape and flatten it out and round it out to a more feminine hairline. So that is the kind of way that people approach me and what is asked of me. But when the pen is in my hand, it's taking that and adding a more artistic element. We see scary things that happen in the industry where people put lasers on the wall and draw a perfectly straight line. People, will just kind of try and draw the most crude, rounded hairline that they can draw, and it doesn't really suit the shape or the face. For me, it's a really collaborative process. I think the three of us were all in the room together. I asked you to move your muscles so I could see how your face changes dynamically with facial expression. And then looking at obviously where I thought would most naturally balance the rounding of Rachel's hairline in her case. And then we looked at also the lower part of the face and how will that blend in to create a full oval effect in total. And those are really crucial things that I'm thinking about when I'm designing things. But I think the other last element is that element of it being a collaborative process. All of us looking at it together and using the mirrors and saying, if you had this, if this was your side profile, if this was your front profile, is that something that you'd be happy with? And obviously it's for me to put my expertise on that, but to make sure as a collaborative that the hairline is something that is desired.
If someone has a severe brow boss, overhanging, a severe ridge, but you're also playing with contours, you're trying to judge the effect in totality on the face.
Yeah.
So does that mean before or after FFS?
I think, again, yes, I think in that specific question where you're looking at a bossing forehead and you're looking at how the hairline goes with those elements, I would say the ideal would be to do it after FFS, because as you said, we're looking at the contours, we're looking at the full globe and remembering that the scalp is a 3D space. So I'm not just looking at how it looks centrally, but also from the side as well. And there are certain angulations that it needs to be on the 45 degree of the forehead muscle, forehead bone, which actually needs to come into consideration. So in that regard, if you ask me to put an answer to it, I would say yes after FFS. But again, other elements come into it. How is that FFS being done? Is it going to be done with a hairline scar? Is it going to be done using a scar that is more parietal? Those type of things do come into the equation. And again, especially even in those questions, if you're going to do FFS and have a scar in your hairline, then actually doing your transplant surgery after that also is a value add, because you can correct the scar as well and conceal that. But these are all crucial elements. The other thing that changes as well is the rule of three. So we kind of the chin to the nose, and the nose to the middle of the eyebrows, and the eyebrows to the hairline. These are three kind of segments of the face that we look at, and the more equally proportioned they are, the more beautiful someone is. And obviously, if you're thinking about doing certain forehead procedures, it may change those proportions. So actually framing the hairline early may mean that you actually counterintuitively change those proportions and limit what the end result might look like.
The same would go for a chin implant then, for a trans man.
Yes.
Let's say you're addressing a widow's peak, and then that would come into play. Oh, okay, all right, thank you.
Yeah, all of these things, and this all goes back to the original concepts of really understanding what your face will look like before you think about how you frame it aesthetically with the hairline.
I for one am very glad that you work the way that you do, and I'm very pleased with the results.
Yeah.
Well, we still have lots to come, which is what we're excited, which is even more exciting, isn't it?
Oh, absolutely, yeah. So getting back to pretending I don't know what we're talking about, roughly how long does it take to complete a transplant, and how many grafts can you normally do in a day?
Yeah, so the hair transplant is a long day, particularly with the care and the attention that is required from a reputable clinic. We start usually at around 7 a.m. And do the preamble, and surgery itself probably starts around about 9 a.m. and can potentially finish at as late as 5 p.m. So you're talking about at least 10 hours throughout the entirety of the day. So that is something that you have to be prepared for. But that being said, I like to think that most patients are able to tolerate the day and are kept comfortable, and it's not too samey. But there are some moments where it can be a little bit samey. Rachel,
the diazepam helps.
And the diazepam helps. Remind me what the second part of your question is. I've completely forgotten.
The number of grafts. How many grafts can you do in a day?
Yeah. So again, slight variations, but if you had to put me to it, I would say about 2,200 to 2,300 is the maximum number of grafts that I would feel comfortable doing in a day, to ensure that I am maximizing the survival of each and every one of those grafts. However, the only challenge to that is that even doing that amount of grafts, we need really good access at the back. So if we are doing kind of window shaves and quite kind of subtle transplants in terms of shave access, we may not even be able to get as many as 2,200. Something like 1,700 to 1,800 is probably the optimal amount, and that would be enough to kind of feminize a hairline from an M-shaped hairline. But if, say, for example, you have experienced crown loss or some mid-scalp recession or thinning in those zones as well, it might mean that we need to consider a different strategy or consider multiple procedures.
Okay. So you mentioned the shaving there. What are the options for that? For me, it was the 2 tiers, but what else could you have done?
Yeah, so there's we talked a little bit about the 2 techniques as an option. So we've talked about FUE, where we take a hair one by one from the back of the head. Now that specifically needs more access, needs the hair to be shaved down to a grade 0. The other technique is FUT, and FUT strip specifically. Now that is actually a good no shave method, where we actually shave the area that is to be removed, remove that piece of skin and scalp. And then once it's removed, we actually stitch up the edges so it leaves a very clean suture with long hair above and below. So that's a technique that is preferred for someone that is absolutely not willing to shave any part of the back of their head, and it is a potential option there. The other option is, like I said, the FUE technique, and then you're talking about needing to shave in some way. Now, the three things that you could do is shave the entire thing. Now, that obviously, like I said, can be quite distressing for someone who is who's in the transitioning journey. But someone who's potentially early in their transition, where they haven't, made as much of a change, maybe more open to having a fully shaven head. And specifically, shaving the head, as I said, gives us lots more grafts that we can take in a day. We may even be able to do a 2-day procedure, and that might be able to allow us to address the crown, the front, and feminize the hairline across those 2 days. So you can actually do a lot more, so that when it's all growing out, and then as you progress through the transition, you don't have to go back in and consider shaving your head in future. The other more kind of common options are the tiered shave, which are the windows that we do, 2 windows or a couple of small ones on the side as well, leaving kind of tiers of long hair in between, so that the idea is those long hair elements will come down through and cover up the windows that we've shaven. And that's actually a really good way of disguising the shave areas. And the other more trendy option is the undercut shave. So you can kind of shave, you can put all the hair up in a bit of a top bun and undercut into the donut area. And that can also give us access to a good number of grafts, up to 2,000 grafts from that technique. So there's a few tricks that I have in my armamentarium to be able to deliver the procedure with minimal shave. But there's and that's a real benefit, and that's something that a lot of my patients really like.
So we talked about pain management during the procedure, and that's diazepam or Valium.
Woohoo. Yep.
quite a solid whack of it.
Yeah.
Was it 22 lots of 10 milligrams, 20 in all?
Two lots, yeah, 10 and 10, yeah, later in the day.
Yeah. So no operating heavy machinery afterwards. But what should a patient plan upon on the day of the procedure?
Yeah, so there's a couple of things moving into the procedure that you have to think about. So, and that can be really annoying, is no alcohol for 7 days. But the other one that really gets some patients is the no caffeine for 7 days. That can be really tricky. And actually, people don't realize that caffeine is something that can thin your blood. And as a surgeon, the last thing I need is blood in my way. So actually getting people to stop things like alcohol and caffeine is really important. So planning for, a window of time that is not before any important or just after any big social events or any events like that you might really require caffeine is quite important. But then on the day itself, understanding that you will have some Valium in your system, but also just remembering that your scalp is numb is really important. People don't realize that actually how much they need that kind of sensation from parts of their body to make sure that they can navigate their head through space at certain spaces. So even as simple as getting in and out of a taxi can be really tricky. So it's not just the Valium, but also these other elements that come into play of making sure you realize you're not quite 100%. So factoring that into your day and your planning is really important. Making sure you're not doing long journeys on the morning of the procedure, and particularly making sure you're not driving after the procedure for 24 hours. And as you said, not operating or making any really critical decisions in those 24 hours is really important as well.
And if you're getting in a car, have someone put their hand over your head and guide you in as if you've just been arrested.
It helps, right? Yeah. I sometimes I actually have to go and do that myself. People often think I'm really, really nice at surgeon because I go right out with them, take them to their Uber to get them home, and they just think I'm really caring. But all I really care about is making sure they don't hit their head as they're going in. I am nice too, but I'm just...
I wasn't ready for losing awareness of where my head was.
Yeah.
I just didn't expect that.
Yeah. Well, also, so regarding blood thinning, where does HRT fit into that? I mean, it shouldn't, should it?
No, I've had no problems. HRT is important. Certain medication you don't want to stop. HRT is important. And if I'm honest with you, no, I've never had any issues not having to stop the HRT treatment. So that's something that you can continue with as routine.
What about heart treatments? The half aspirin a day, the baby aspirin that people sometimes take. Do they stop those?
Things like that, yeah, absolutely. I mean, they're a drop. Taking caffeine and alcohol are a drop in the ocean compared to those treatments. They are very strong blood thinning medications. So specifically, that is something that we would recommend to stop 7 days before. If you're on any more serious heart medication that thins your blood, then we actually have to be in touch with your cardiologist to make sure that there's a right balance between the safety of stopping those treatments and doing the surgery. So these are important considerations. And it's, again, important why having a doctor that's really kind of considerate of these elements is crucially important for your own safety. The other thing that's quite important, a lot of people, anyone that suffers with things like ADHD, can be on things like Elvance and are common stimulants. That's a really tricky place because you kind of want to get a balance of making sure that you're comfortable during the procedure, but at the same time, the stimulant is not thinning your blood too much. Sometimes we may recommend a half dose, or we may recommend kind of stopping just on the day of surgery itself. So there are nuanced medications that, again, just having a really open consultation with me, letting me know what medication you're on, and we can work through them to say what to start and what not to stop.
Right. Makes sense. Also, that your nightmare patient would be someone who goes on a 3-day bender and then takes a bunch of asprin on the morning of the surgery to deal with the hangover.
You'll be surprised. We've had a few nightmares in the past. Not even far from what you described. And to be fair, if that came to light, we would probably have to politely, kind of put a pause on surgery and say it's just not safe.
Yeah, fair enough.
So I think we've pretty much covered the procedure itself. Now let's move on to the aftercare.
Mm-hmm.
Just talk us through the days afterwards and things like how long before you can dye your hair, how much time off work, wearing hats.
Yeah. For sure, absolutely. So I always say that after surgery, it's really important to understand that we don't glue the hairs in, we don't stitch the hairs in. We make a hole, we put a hair in it, and it sits very precariously, very delicately in that hole. And it takes around about 48 hours, if not, 3 days, to see those hairs now starting to bind and become stuck in the holes that we've created. So in those first 3 days, those grafts being so delicate, it's when you as a patient need to show the most tender loving care, the most TLC. So in that aftercare process, there's a lot of things to do with kind of being careful not to touch the recipient zone, not to sleep on it. You can't wash it, but you can spray it. And we actually ask you to spray it. This can be a bit of a nuisance. You have to kind of put your timer on every 30 minutes and spray your hair and spritz it just to, again, keep it hydrated and keep it healthy. So in those,
You're very good at that.
Yeah, good. Exactly. That's exactly the kind of commitment that I would want from my patients. And so lots of TLC in those first 3 to 4 days. After that, you're kind of out of the scary woods where the grafts can be dislodged because they're now kind of in place. But there starts to become a few more signs of surgery. You'll see the scabbing in the recipient zone. You'll see the healing happening in the donor area. Now, you can wash the donor area pretty quickly. For a lot of my trans patients that have had the tiered shave, we don't even put a bandage on. So it is just a matter of just going straight to washing, which is quite a nice, touch that you don't actually have to remove any bloody bandages. It's just about giving it a nice wash the next day. But in the recipient zone, like I said, those scabs over the course of 4 days through till really up to 10 days, those scabs start to become more and more visual. The beauty of the minimal shave is that you can kind of keep the hair long around it and cover it up, but they are there, and you need to start doing certain washing routines to help remove the scabs. And it takes around about 10 days to 14 days for those scabs to come away. After that point, so after that 10 to 14 day mark, your grafts are now scab free. your donor site that is actually really well healed. And so from the recovery point of view, there's not really much to do apart from things like protect it in the sun, being careful with things like swimming. And really, it's just a waiting game for letting some of the redness subside, and letting the hair grow out at the back. But on the underneath the surface, the skin is healing, and there are things that you can experience. A bit of itching, some sensitivity in the donor area, even sensitivity in the recipient area. These are all things that you have to be a little bit careful about. And it can take a couple of weeks, if not a couple of months, for some of those things to settle down. So those are considerations that could kind of persist after that 2-week mark. With all of that in mind, all of our aftercare routine that we give in our clinic is catered to the fact that you get past the 2-week mark, and then you're in a place that we can start being a little bit more generous about concealing the hair, whether that's wearing wigs. So I usually say to my patients, you can wear wigs after 3 weeks if it doesn't use any glue, sometimes a bit sooner if everything looks healthy and clean. You can start styling your hair and cutting your hair with scissors 2 weeks after surgery as well, which can be helpful to kind of help, again, disguise some of the signs of surgery. And then when it comes to more kind of other things like, adding extensions, I would say wait a little bit longer, at least a month, particularly if it's close to the recipient zone, or in the donor area. And the other big one is hair coloring. Again, depending on the type of coloring and the area that you're doing it, if it's close to the areas of surgery, we try and say give it at least a month, but actually sometimes that extra bit of caution up to 2-3 months is sometimes a good thing as well. But getting past that first month is particularly important.
Yeah, I'm holding off, as you might be able to see.
Yeah, absolutely. You've done really, really well, and we'll get that red back in there soon enough.
So what about returning to work and things like exercise? Do we have to worry about that?
Yeah, absolutely. Sorry, I should have mentioned that initially. So yeah, returning to work and exercise is some things that you just have to be a bit cautious about, particularly exercise. Again, remembering the grafts are very delicate in those first few days, and we don't want to push them out. So it's no exercise for the first week, understandably. After a week, you can go to light exercise, nothing that makes you sweat too much, because again, that can be an infection risk, and it can also be quite uncomfortable for the recipient zone particularly. So we say light exercise after a week, which is kind of using a stationary bike or going for some light jogs is absolutely fine. More strenuous exercise, going to the gym, we're lifting weights, are not something that you can do for 2 weeks. And then anything with contact sports or anything that wears helmets, things like that are something that we ask that you wait at least 3 weeks, if not up to a month after surgery. Again, depending on how things are healing. In terms of work, most patients are really kind of completely with it quite soon after surgery. So if you're working from home and it's about a matter of dealing with emails, you can work within a couple of days. But if obviously, we always recommend giving yourself about 3 to 4 days at the very least, just to give yourself some TLC time and some recovery time.
Nothing too hairy.
So no, but yeah, nothing at all. Give yourself that TLC time in the first 3 to 4 days after surgery. So depending on the nature of the work that you do, like I said, especially with our minimal shave, where you can cover up the recipient zone and the donor site is covered up if you're having a tiered shave or an undercut shave, then you could go back to work as early as 5 days to a week after the procedure. However, be mindful that under the bonnet of all of the hair, there is signs of surgery. The scabs are there. There may even be a bit of sensitivity. So just having that extra bit of time, maybe up to 2 weeks, to make sure that you've got no scabs at the front and the back and the sides have healed well, that might be, the safe bet for returning to work if you really kind of don't want people to know and see the potential signs of surgery.
So, this is surgery, and there are risks with any surgery, but this is different to how people think of other, getting really inside the body type surgery. What are the risks, complications, and what happens if the grafts do just fall off like leaves in autumn?
Yeah, absolutely. I mean, I think people don't realize that this is surgery. It isn't as invasive. It's by definition minimally invasive, which is great. but you're cutting the skin, and in some cases you're cutting the skin up to 2,000 times. So if you actually think about the total trauma done to the skin in terms of the area, it's probably can be more invasive than a single cut that is done with internal surgery. So in that element,
I think the previous limit was death by 1,000 cuts. So,
so you know, that is something that you have to factor in, and there are risks associated with it. In the right surgical hands, in the hands of the right clinic and the right surgeon, using good surgical technique, we can mitigate a lot of the risks. Those risks are things like, you know, infection, things to do with taking medication, allergies, but also, you know, reactions of the skin. If you're not too careful, for example, and if you over traumatize the skin during the surgical process, you can actually cause the skin to die. This is a phenomenon that we do see in poorly performed hair transplant surgery, where we get something called skin necrosis. And these are things that we've experienced and we've seen in the industry. And actually, like I said, when you're doing your surgery, you're taking steps and measures to mitigate those risks as much as possible. You know, when surgery is done really badly, really poorly, there has actually even been deaths now from hair restoration surgery in the international landscape. There's one case where I believe 8,000 grafts was attempted in a single session, and unfortunately that patient didn't survive that procedure. So there are risks with this procedure for sure, and those are just to name a few. But like I said, in the right hands, it's a really safe and it's a really well tolerated procedure. In terms of what happens if it doesn't take, if it all sheds, well, we actually do expect some shedding of the grafts in a way that they will come back. But if in a year's time we look at the result and all of a sudden there's no hair that's grown, it can happen. Thankfully, you know, it's not happened in our clinic for forever, really, but it can happen with poorly performed surgery. In that circumstance, you have to kind of revisit to see, well, why hasn't that taken? It might be that there's another form of hair loss that is causing a problem. That means that those hairs will never be able to be transplanted. If hair loss is an issue in the first place, it might be, again, just poor surgical technique. If it's the latter, you know, reattempting the procedure in a more careful and methodical way, slightly less kind of intense, not maybe achieving high densities, is a good option to see if those take, and usually they quite often will. But that is also contingent on making sure that you have enough hair at the back and the sides to take across. So again, really careful, considerate surgery, making sure that we're not trying to lose too many hairs from this area, so that if we did need a further procedure to touch up either the original procedure or other areas of hair loss, you have that donor area available. Okay,
and what if someone's had a poor result from, say, hair being put in at the wrong angle, not through you, but some other clinic?
No, absolutely.
Can you fix that?
Yeah. So I don't know if it's a good thing or a bad thing, but over the years we've now established ourselves as a repair clinic, and where we do have a lot of patients who have had surgery. And what we would describe as botched surgery. You know, I talked a lot about angulation of the hair as part of the implantation technique. And it's really important to get not just the right angle at which the hair exits, but the direction to which it flows. These are all crucial steps that we would do as part of the surgery. Now, the problem is if you go to a clinic that is not as experienced or using maybe a technician-based model for their surgery, these considerations don't go in, and hairs are kind of implanted a bit like soldiers in a military rank, and they're all vertical and upright, and they kind of sprout out and look really quite bad and really unaesthetic.
Pincushion.
Yeah, exactly. A bit like a pincushion in terms of the way it spreads out and the way it looks. So that's we see, unfortunately, in our industry, and those type of botched surgeries are becoming actually more and more prevalent. We've actually produced a lot of research in the last few years showing just how almost exponential these cases are becoming, and how many inquiries we're getting related to people having these botched procedures. Can we fix it? It's obviously a case-by-case basis, in the sense that some people, they've had this botched surgery at the front, but they've also had the back of the head completely traumatized where they can't be helped. And those type of cases are actually really sad, because actually we can't do anything because we have no hairs to work with to be able to correct the procedure. So that's really quite sad. But if that is intact and there is some hair at the back and the sides to work with, we can repair it. Sometimes we may even need to extract the poorly angled hair in the recipient zone and replace them somewhere else in the scalp, and then kind of come back again another time once the skin is healed to then reimplant hairs at the correct angle, with the correct kind of artistic elements that you would need for a more natural looking transplant. So yeah, absolutely. That angulation is so important, and achieving it right the first time is actually far better than going for kind of, a really kind of cost-effective surgery that doesn't think about those angles, that doesn't think about those natural elements that are needed for the hairline.
You've touched on quite a few times now. You've referenced bad places that do hair transplants, and it's not a cheap procedure, and obviously money is a big factor for trans people, because as we've touched on earlier, there's so many procedures. So what would you say to someone who is maybe tempted to go to Turkey and have a transplant over there at probably the third of a cost that they have it in the UK? Why should they come to you, or should they not come to you? But have you got advice for someone who maybe has to go to Turkey and what they should look for?
Yeah, no, really good question. Look, Turkey has some great clinics there that produce some really good surgery. And equally, there's places in the UK that produce really bad surgery. And so I think when we talk about the black market of the hair transplants world, we're not specifically talking necessarily about a country. We're talking about a type of practice. And that practice is this kind of economies of scale model. And when you talk about price, a lot of these clinics can offer really cheap prices, because what they do is they sometimes don't, but they have maybe one surgeon, and they'll have about 5 or 10 operating rooms. And what that surgeon does is will draw a hairline and then kind of maybe even put a bit of anesthesia in, and then leave the rest of the surgery for the technicians, who will then go on to do the procedure. And then they go on to the next room and the next room and the next room. And so in that regard, where you're paying for one surgeon, and then the rest of the staff is all technicians. And bear in mind, technicians are not medically trained. They're not nurses. There's stories of technicians who the week before procedure was an estate agent, or the week before procedure was a cleaner. Now, there's nothing wrong with those jobs, but they're not medical jobs. And those people and those individuals are then left to independently operate on someone's scalp a week later. That's where I have a bit of an issue. So specifically in that regard, what those patients who are going to those black market clinics are doing is they're really putting themselves at risk, having a surgical procedure under the work of a technician who may have very little experience doing a hair transplant. And that is where this idea of, when you go to Turkey, it's pot luck whether you get a good one or a bad one, because you might even go to the same clinic and meet the same surgeon that your friend who went to that clinic also had surgery and had a good result with. But you may have a completely different technician, and the quality of work that you receive is completely different and can easily be botched compared to what another person at that same clinic would have experienced. So that is what I would always say to you. If you're thinking about surgery and you're thinking about doing it economically, there are clinics out there that are still more affordable, but they will provide you with the information that you need to know. And that information is who's actually doing your procedure. What experience do they have? Is it the surgeon that's doing the surgery, or is it a technician? If it's a technician and you're comfortable with it being a technician, fair enough. But how much experience does that technician have actually doing the procedure? So I appreciate that our service is expensive and compared to what's out there on the market. And it's because as you experience, it's myself that does the lion's share of the procedure. I do all of the cutting of the skin, the incisions that all the hairs go into, and I'm on the scalp when the hairs are going back in as well. So that's the level of care that we offer in our clinic. And I'm not expecting everyone to be able to afford that level of service. But if you're going and looking at it from a more economical point of view, it's absolutely fine to seek, international clinics, even to use UK-based cheaper clinics. But make sure that you ask the questions: who is doing my procedure? How much experience do they have? And sometimes, if some clinics don't give you those answers, quite often it's because they're cutting corners in that regard.
Yeah. I did my due diligence, and I just decided that it wasn't worth the risk. And we had our consult, and you were probably the third or fourth we'd spoken to.
Yeah.
And we vibed. We liked you. Yeah. We liked what you were saying. We looked at pictures of your work. We looked at pictures of other people's work, and that's how we made the decision.
Yeah. Yeah, absolutely. It's such a, I'm always really privileged, to with the transgender work that I do, because I understand it really is a part of a journey, and the work that I do kind of is a piece of that puzzle, and it's a really profound journey. And I see patients at the beginning of their transition. I see patients towards the end of their transition, and I see the genuine difference, emotive empowerment that it achieves as you go through that transition journey. And like I said, I'm really privileged to be part of it, and almost more powerful than some of the hairline restoration work that I do. It's such a meaningful change that. And there's so much emphasis on it that you don't want that botched. You don't want to cut corners in that regard. So, like I said, and I'm not saying every person out there needs to come and have surgery with me, but it is about making sure you find a surgeon that you vibe with, that is singing from the same page as you, and that resonates with you. You might go in there and you might go to a perfectly good surgeon, but just not like the hairline that they've drawn or something like that. And there's certain things that might not click. And even if that's with me, I don't mind, because as long as you find someone that you are on the same page as, that you are resonating with, that's the person that you then have your surgery with.
Oh, I think we resonated quite well, right?
Oh, we did.
Are there any new techniques coming or emerging technologies that have you excited?
There are always things that are developing in the hair transplant space, and I'm always keeping an eye out for those things. Is there anything that's particularly got me excited? Unfortunately, not something absolutely captivating. Just to be completely frank. There is definitely some exciting stuff. I know the Fargo Clinic up in Manchester are working on hair cloning. At the moment you can freeze and bank your follicular roots, and with the potential that in the future, if we can clone these hairs, then you have a potential endless supply of grafts. How is that not exciting? We have different forms of stem cell therapy that is out there, and that's again all really exciting. Annoyingly, a lot of these things are not there yet. They're not providing us with the meaningful change or the meaningful kind of success that we would want to see to really start getting excited about them. And from my understanding, they're still a good decade, if not 2 decades out from being anything more meaningful. But there is definitely some interesting stuff on the horizon. I'm, like I said, always keeping my eyes peeled for new things. It's still very much a case of watch this space.
Yeah.
You've done it once again. You stole my follow-up question.
I'm sorry.
I was going to, because obviously hair transplants, you can't use hair from another person. You can't use a donor because the immune system rejects the follicle, yeah?
Yes, very much so. Yeah, absolutely. So you can't take a hair from somebody else in the same way you can't take an organ from somebody else that without matching it. Now, some people say, well, yes, we do take organs from other people, but in those situations, it's blood matched, and then the person who receives that organ needs to take immunosuppressants for the rest of their life. So obviously that's not something that you would do
Yeah.
for a hair transplant. There's no clinical, it's not clinically right probably to ask someone to do that.
But cloning someone's hair would be a game changer.
Cloning someone's hair would obviously be an absolute game changer. I think when it comes to cloning, again, it comes down to what I was saying, how the follicular root and the hair root is actually in its own right a mini organ. If it was just a matter of just cloning and copying a couple of cells, that would be super easy and we would have done that by now. But there's so many intricacies in the hair root itself. The matrix, the types of cells that go into it, and the fact that it's all then composed at a microscopic level, it makes it actually an incredibly difficult thing to clone. Again, watch this space, because I know our colleagues at the Farjo Clinic in Manchester are working on this with some respectable research institutes, but it's still a bit of a way out from my understanding.
One day they'll be changing colours like an inkjet printer.
Yeah, well, that's what a lot of kind of stem cells are looking at doing, right? Is using inkjet printer kind of elements to kind of print cells onto cellular matrices and matrices and things and stuff. So, but I don't think they're able to do that on the level of a hair follicle.
One more thing.
Go for it.
So, can you do hair transplants to other places other than somewhere else on the scalp? Like, can you do eyebrows?
Yeah, absolutely. You can. Yeah, I think we talk doing full circle of this. What has been a really fun conversation. But as you know, back in the 1930s, it was done all over the face in various different places. So absolutely, you can technically take a hair from any part of the body and put it to another part of the body. That can be done. And more popularly, now we are seeing that we are doing eyebrow transplants. We're doing beard transplants. You can take it from the back of the head and do a beard transplant. So again, from female to male transition elements, you can create a beard and even moustache transplants and things like that. So
yeah, that's kind of where I was leading, because I know a lot of our trans brothers really have trouble growing facial hair, so that
absolutely, it's something that something that we do, and we have done many times in our clinic.
I'm excited. I can finally get that monobrow.
You'll be just like me then.
I think that's it.
Well, it's been the opposite of a plucking good time.
It's been great.
Thank you so much, Dr. Dilan, for joining us. It's been such a pleasure.
You're most welcome. Thank you for having me. I've really enjoyed being on the podcast and enjoyed being spending an evening with both of you and having a fun chat.
It's just as much fun as the consults were. Can you just say follicular for me again?
Follicular.
Nice.
No, the consults were fun. This has been fun. I hope, at least in the work that I do, it's informative and it can help people out. That's the most important thing. Like I said, this is not about me saying come and see me as a clinic, but genuinely just do your due diligence, do your research, and just find a surgeon and a clinic that really resonates with each and every patient out there, because they'll be the right person there for you.
A plucking good time, really?
I couldn't help it.
Okay, so what were your highlights?
Well, they're mostly blonde, but I'm preferring the pink now.
Oh, for follicles' sake. Focus, Phoebe.
Okay, fine. Well, as we talked about in the intro, his passion comes through, but this is also a serious surgery, so being prepared is key.
Right. You have to pay attention to the pre-surgical advice. I mean, it's really tough giving up the caffeine.
Right.
And also the post-surgical care. Mm-hmm. They're all very important. If you don't want to end up obstructing the surgery or losing too many transplanted hairs, watch out for those cuckoo-hoods.
Oh, yeah. Or, as our friend did, low-hanging tree branches.
Low-hanging tree branches.
Yeah, also, for trans patients who want to make the most of any growth they can get without having too much of a slash process in the meanwhile, you can do this as a 2-stage process.
Yeah, there are risks from poorly conducted surgeries that can include skin necrosis, but they're minimal if performed well.
Yeah, let's talk about that. So the advice wasn't to avoid any discount clinic or all medical tourism at all, but it was, in this type of op, to stick with a clinic with an excellent reputation.
Yeah, do your homework, basically.
Yeah.
Right? The danger comes when the surgeon has minimal input, maybe drawing the hairline and starting off the procedure, and then everything else is left to technicians who don't even need to be trained as nurses. This could be literally anyone. And if you do look for more affordable options, just make sure you find out how much of the procedure the surgeon will do.
Yeah, if it's left up to the technicians, be comfortable with their level of experience. I mean, he told the story of technicians who, might have just been serving in a restaurant the week before.
Yeah, scary stuff.
Yeah, so find out first.
Yeah. Is that it?
I think it is.
Okay, well, we hope you enjoyed this episode as much as we enjoyed putting it together. Strand by painstaking strand. And if you haven't already, do listen to Marcy Bauer's 2 previous interviews as well.
Right. I know there was so much info from her, just like all the interviews we do with surgeons, but that was the first 2-parter we've done. It was a good listen.
Yeah, well, there's so much. She had so much information to impart. I really enjoyed talking to her.
Yeah. So until next time, thank you, dear listeners, for being part of our community. And if you want to connect with us further, please visit our website, redandfreckles.com, where you can keep up to date on all things red, and some of them freckly.
You can also find us on Blue Sky Threads, Instagram and Facebook, but not Twitter. We use the handle @2damptrans on all platforms, and you can DM us if you have any questions or topics you'd like us to discuss.
Don't forget to subscribe and rate us on Spotify, Apple, YouTube, or wherever you listen to podcasts. We're on all the popular platforms now.
And as always, even some of the unpopular ones too.
We do appreciate your feedback and support.
So until next time, remember, you are valid.
You are beautiful.
And you are transcending boundaries.